Cybersecurity practitioners, and because of digital health, the healthcare organizations that those practitioners serve face ever-changing new challenges. Two things I want to talk about briefly today are risk management and governance. Healthcare, more than any other sector, struggles with risk management. They are either not doing it, do it poorly, or think they're doing it, but they're not actually managing risk. This is true even in covered entities and business associates that have a regulatory mandate to address risk management. To see this in action, look at the record of accomplishment for healthcare and healthcare-related entities in the United States that currently have a regulatory mandate to address the U.S. Health Insurance Portability and Accountability Act, HIPAA. These organizations have had for the last 20 years a regulatory requirement to undertake risk management. And yet we see things like Change Health and the Ascension ransom event, and we're not doing as good a job as we should be doing. Another reason risk management is not executed universally or effectively in healthcare is that there can often be a disconnect between risk that an enterprise faces and the specific countermeasures and practices that are driven by regulatory compliance. A situation can arise forcing those in the enterprise to decide if they implement one control because it addresses a regulatory or customer requirement, or a different control that has, for the organization, better overall risk reduction. Now, one can argue that risk reduction is overall a better use of enterprise resources, but meeting the requirements of a regulation is often non-optional. Compliance-driven efforts, while ensuring that a minimum baseline is achieved, sometimes do so without accounting for the specific risk that the enterprise might encounter. These organizational determinants are typically non-customizable, meaning that every provider under the umbrella of HIPAA privacy rules and security rules must meet the same level of compliance. That means for certain organizations, the minimum baseline may be sufficient for risk mitigation and compliance, but for others, it will not be sufficient. A large academic medical center in a city with more than 1 million people will have a much heavier lift, including more risks and more vectors, than a critical access hospital in a community with 2,700 people in it. They will also require a vastly different approach to resiliency. Lastly, healthcare enterprises are becoming increasingly complex, including not even being healthcare enterprises, organizations like Best Buy or Walgreens, for example. Risk management requires that covered entities understand things that are very hard to measure and moderate. Things such as the likelihood of a situation occurring, like the Change Healthcare attack. Most organizations didn't realize that they would even be impacted in the way they were should change go down. The impact if that situation does occur, for instance, a nearby hospital being ransomed, we now have studies that indicate that if a hospital in your vicinity gets ransomed, you will have impacts from their being out of commission. The relative difference in likelihood or impact before versus after a control or countermeasure is implemented is also very difficult to predict. Each situation is supported by so many independent variables, influenced by many what-if scenarios, and includes so many outliers and other unique factors that it is not an exaggeration to say that a healthcare enterprise could invest its entire security budget in risk management and still not get it 100% correct. The other issue we will be seeing coming in 2024 is governance. This year, NIST, the National Institute of Standards and Technology, rolled out version 2.0 of the NIST CSF, or Cybersecurity Framework. In addition to the original 5 core functions, identity, protect, detect, respond, and recover, it introduces a 6th function called govern. The govern function focuses on governance-related cybersecurity activities at an elevated level. It emphasizes that cybersecurity is a significant source of enterprise risk. The govern function covers people, process, and technological elements that cover the roles, responsibilities, policies, procedures, and oversight in addition to the technology. This is a broader, deeper, and more formalized approach to governance that is not, I'm sorry to say, often seen in healthcare organizations.